Hi everyone, Dr. Patrick Lynch here, and this is a short version of the previous video that I uploaded earlier today. This is a short version on this patient in his mid-50s. He came to me about a month ago on January 12th of 2025, and his chief complaint was memory loss. He had significant short-term memory loss to the point to where he couldn't remember anything 2 minutes prior. He told me that his symptoms began during COVID and after COVID and early 20s. Since COVID, he has gotten significantly worse. He had reported that he has been to many doctors. No doctors have been able to help him, and he's proceeded to get worse. He's partially functional. He has a business where he has 15 employees. He doesn't have to be on site. And for some reason, his business has been doing okay. But at any rate, it's my responsibility to dig into what's going on with him. A lot of times people will tell me what they think is going on with them. And so it's my responsibility to do some digging and find out. One of the red flags that come up for me is when people have trauma, chronic stress, an acute stressful episode, or something like a virus or COVID or something like that. What it might do is it could open up dormant pathogens in the body. A lot of times, the immune system will keep pathogens locked up in their safe little houses. And when the immune system becomes compromised and doesn't function as well as it should, or could, I should say, then these pathogens come out of hiding and start feeding off the body. And when they start feeding off the body, then they leave antigens behind and toxins behind, and they start doing damage to the body, which cause symptoms and cause loss of function a lot of times. So we're just going to get into his symptoms a little bit, and we're going to compare symptoms. It's like a 5-week comparison chart from the first time we spoke, and then 5 weeks later, the next week we spoke. He told me that he had 6 or 7 things going on. Short-term memory loss. He had some aches and pains. He'd had a headache for the last 5 years nonstop. It never went away, and some other things. And so it's my responsibility to do some digging to find out what else is going on. And I'm not the type of person who likes to hand somebody a sheet of paper and tell them to fill out all the boxes of whatever symptoms that they might have. I like to connect with people. I like to find out what's going on with them from them directly. I want them to tell me what's going on with them, not a piece of paper. It's important that way. It's important that people share with me what's going on with them because that's part of the healing process. When they feel heard, then they know they're being heard and they have some trust and some curiosity of what could be next. And so that's why I like to give people an opportunity to tell me what's going on. So I did some digging and I found that this patient had about 78 symptoms, and many of them were severe. And so we're going to go over this patient's initial presentation and their comparison after 5 weeks, basically all in one shot as we go down the list of this person's chart. So this person's chart, he does not have his name or his date of birth or his location on this chart. However, he did give me permission to share his chart. And so that's what we're doing here. I'm going to share my screen and we are going to go over what's going on with him, how I perceive what his prognosis is. Then we're going to compare symptoms after his 5-week check-in. So we're going to compare his symptoms with the 5-week check-in as we go down the list. So I'll share my screen. Bingo. We're going to go over his chart first. And so yellow indicates improvement after the 5-week check-in. Gray indicates no improvement or worsening. So we're talking 5 weeks from this patient's check-in, okay? This patient has had these symptoms for the past 5 years, has seen many doctors, and have not had any help in terms of resolving his symptoms. He reported having long COVID in 2020. That was the onset of the rest of these symptoms that we're going to go over. He had significant short-term memory loss. The testing that was done for that was a brain scan. They found a black lesion in his brain. Black lesions are commonly associated with multiple sclerosis. Multiple sclerosis is an autoimmune disease of degeneration in the brain caused by amyloid plaques. Amyloid plaques are commonly associated with bacteria or a parasitic roundworm, microscopic parasitic roundworm, or more. There could be other pathogens involved with MS. MS, most times, if not all the time, is caused by a bug. It's caused by pathogens. So if you know how to go after the pathogen and get rid of the bug, you can reverse MS. I've done it and am doing it currently. So, however, memory issues, number one, that's his chief complaint. He had a 25% improvement with his memory issues after 5 weeks of treatment. He had forgotten to breathe. It's much better after 5 weeks. Since day 3 of the dietary modifications, his headache was gone. He had a sensation and a sound of metal grinding sound in the back of his head and the sides of his head. And during the 5 week check-in, it happened twice within the previous month. He had a dome feeling of headaches over his head, and it was significantly less after 5 weeks. He had hearing loss. It's in the process of changing after 5 weeks. He had his color and his vision would change and go from seeing color to black and white. And it was gone during the 5 week check-in. He didn't have that symptom anymore. He had thick saliva, really thick saliva, and it wasn't thick most of the time after 5 weeks. He would dry heave for 5 minutes to an hour, 3 to 6 times per week. At the 5 week check-in, he didn't have that anymore. He had a sharp kind of stabbing pain in his chest all the time. And at the 5 week check-in, it was intermittently mild. He had sensations of shards of glass in the body. At the 5 week check-in, that was zero. He would feel like his body was on fire. At the 5 week check-in, that was zero. His body temperature wouldn't regulate. He would feel hot and burning in the bottom part of his body and cold in the top part of his body. That had improved. He would have 10 to 15 episodes of diarrhea per day with multiple different colors. At the 5 week check-in, he had diarrhea twice, and he was having 2 solid bowel movements per day. He didn't have an appetite when we first started. Now he has an appetite and he's eating well. He would have regular episodes of nausea after drinking water, doesn't have that anymore. His bladder was killing him. He would have burning bladder pain, no pain anymore. When he would grab a sandwich to eat, instead of biting the sandwich, he would bite his hand. That's not happening anymore. He would have intermittent episodes of joint pain that would go from one joint to another and rotate throughout the body. That was gone in 3 days. However, he still has crunching sensations in his neck. He would have regular nosebleeds. That is gone. Bruising easily has improved. His coordination is not what it used to be. That has improved. Hair loss. His fingernails are growing, improving, and his hair is starting to grow back. This is after 5 weeks. Severe anxiety. Huge reduction in severe anxiety. Occasional drenching night sweats. None within the past 5 weeks after treatment began. Gripping, aching pain in the chest region, but not often. It transferred to more tightness instead of gripping pain. Ear pain and tinnitus, that's less. Shortness of breath is less frequent. Difficulty swallowing, none. Acid reflux is gone. Episodic tachycardia hasn't happened. Skipped beat arrhythmias, significantly less, but it's still there. Pain between the shoulder blades and between the back of the neck is gone. Serious excruciating pain in the abdomen is gone. Tingling in the limbs with his limbs falling asleep, it's significantly less. Slow urinary flow is significantly improved. When he couldn't urinate, a lot of times when he would go to urinate and he couldn't, he would end up defecating himself because he couldn't control his bowel movements. So he would have diarrhea in his pants daily from not being able to hold it. He had numbness and tingling in his fingers and his feet, less frequent and doesn't last as long, less severity as well. He had sharp shooting electrical-like pains in multiple places around the body. Zero after the 5 weeks. He had hat head syndrome. Hat head syndrome is when you take off your hat and you feel like you still have your hat on your head. Not a serious thing, but noted. Circulation issue, as well as neurological. Energy is great. That's his report. His energy, he basically what he's trying to say is he has energy and he feels like he can go ahead and get on the bike and ride 10 miles. But then when he goes to use his body, he doesn't have any energy when he uses his body, which is pretty interesting because a lot of times people have chronic fatigue and they just don't have any energy to start. In his case, he feels like he has energy, but when he goes to use it, he can't because he doesn't have energy when he starts to use his body. He had dull achy pains over the area of the left chest. He had stabbing pain in the center of the chest frequently. Dull achy pains were gone. The center stabbing pain was minor. After the 5 week check-in, his sleep had significantly improved. He went from sleeping not very well to waking up every hour during the night to sleeping through the night, sleeping 6 to 8 hours per evening. His depression was significant. It's significantly less now. He had a little bit of pain on the bottom of the feet. Now it's more sore. Same with the hands. He had pain on the palms of his hands that transferred to soreness. Often he could not feel what he was holding. That doesn't happen anymore after 5 weeks. When he would put his fingers together, he wouldn't be able to feel his fingers. That also is good now. He can feel his fingers when he touches his fingers. He would get intermittent hives, not anymore. He would get shaky, gone. He would get into fight or flight mode. That happened 3 or 4 times the last month. Congestion, significantly better. Burning eyes, better. Numbness and tingling in the face, head, and cheekbones. Gone in the face and cheekbones, but still had it in his head. Low back pain with sciatica is significantly better. Burning pain in the groin and genitalia, significantly better. Bloating, almost gone. And 13 to 15 bowel movements a day that were diarrhea that are now regular with 2 regular bowel movements per day. So, what is going on with this guy and how did he get better so quick? This is a classic example of somebody with autoimmune disease who has early onset dementia, who has pain and an array of multiple different types of symptoms that affect basically all systems of the body. We have just about every system of the body that's affected with what's going on with this individual. Family doctor would probably refer this person out for his neurological symptoms with the numbness and the tingling and the head, face, cheekbones, arms, hands, feet, and legs. The doctor would probably refer out to a urologist for not being able to urinate and having slow flow. The doctor would probably refer out to GI doctor for having 13 to 15 episodes of diarrhea per day. The family doctor would probably refer out to a cardiologist for having intermittent episodes of tachycardia as well arrhythmias. And the family doctor would probably also refer out to the neurologist for having short-term memory loss. The family doctor would probably refer out to an ophthalmologist or an optometrist or some sort of eye doctor for burning eyes. Also a urologist for burning pain in the groin and in the genitals. Let me see what else is going on with this individual. For his ear pain, he would probably be referred out to a ear, nose, and throat specialist. For his ear pain and his tinnitus, for acid reflux, he'd probably be referred out to a GI specialist. For the aches and pains in the joints, he'd probably be referred out to an orthopedist of some kind. So you have about 6 or 7 referrals that he would be referred out to. I'm an infectious disease specialist. I'm an autoimmune disease specialist. And I see this person's chart and I'm like, okay, what's going on here? So all of this was triggered by COVID. Okay. So let's just say that it was. He says that it was. Knowing that, we know that COVID can weaken the immune system. When the immune system is weak, dormant pathogens can come out of hiding in the body and start to feed on the body and release antigens and toxins and start causing symptoms like this in the body. And so The body's immune system never really turns back on, or even if it did turn back on, and even if it did turn back on, the pathogenic load is so elevated that the immune system needs help. The immune system needs help to get these bugs under control. And so, what kind of bugs is this person presenting with? So, I'm seeing a trend with a malarial type of infection. That's one of the strong infections that this person has. And the reason why I see that is because burning pain in the groin and genitalia. Whenever you have burning pain, you have a Bartonella infection more commonly, especially when the symptoms appear in clusters. For example, burning pain in the groin and genitalia, burning pain in the eyes, Bartonella, night sweats, nightmares, numbness and tingling, anxiety, common for Bartonella. Bartonella likes the eyes. When he would lose the ability to see color and his vision would go black and white, that's commonly Bartonella. Sensations of shards of glass in the body, that's Babesia. Babesia is another malarial type of infection. Feels like his body is on fire. Bartonella. Temperature doesn't regulate well. Could be anything. The episodes of diarrhea that he has could be Babesia, could be anything, but I'm picking up Babesia because he has other Babesia-like symptoms. He reports that he has burning, bladder pain, Bartonella, nosebleeds, Bartonella, hair loss, Bartonella, and Babesia. Severe anxiety, could be anything. Cramping, cramping in the calves, cramping in the chest, Bartonella, Babesia, gripping, aching pain in the chest region, Bartonella, Babesia. Ear pain is commonly Bartonella. Episodic tachycardia with a skipped beat, malarial infection, Bartonella, Babesia. Could be anything, but those two are prominent. Numbness and tingling in the feet and the fingers could be anything. Sharp shooting, electrical-like pains, Babesia. Anytime you have sharp shooting, electrical-like pains, you have Babesia more times than not. So this person has what I diagnose this person with is multiple systemic infectious disease syndrome. Multiple systemic infectious disease syndrome is caused by chronic infections. It is very clear to me that this person has chronic infections, and I put him on a protocol to help get his chronic infections under control. And within 5 weeks, he had a significant improvement. I anticipate that he will be in complete remission within 15 weeks. His treatment won't be done, but he'll have his life completely back in 15 weeks. And he's probably about 8 weeks in. He's probably about halfway there right now. He's doing great. He's been having these symptoms for 5 years, and he has seen many doctors who couldn't help him. And he had found me, and within 5 weeks, we got his symptoms under control, and they're going to continue to get under control. And he's going to be able to put this behind him and get his life back and not have to worry about this ever again. And the reason why is because I'm going to educate him on how to prevent this from happening. And if for some fluky reason it does happen, he'll know what to do. This is a case where many times people will just continue to go downhill. They will have pharmaceuticals be provided for them. They'll have procedure after procedure done for them because chronic infections, they consume the body, they eat the body, they cause problems. He had urinary problems, neurological problems, cardiovascular problems, all kinds of issues with all systems of the body. Got insurance, and granted, insurance will pay for all of this, but you would go down the road of probably anywhere between now and 5 years before he dies. He could have $1 million in hospital bills and medical bills and surgical and procedure bills that insurance companies would pay for. When he's done with my treatment protocol, he'll probably end up paying about $8,000 to $10,000 and he'll be done and he'll have his life back. So something is wrong with the medical system, and there's a lot that people are not getting educated about the cause of their chronic illness and the causes of their chronic symptoms. People, I'm just telling you, The cause of chronic illness and the cause of chronic symptoms are bugs. They're chronic infections. I'm sorry to say it, but you're gonna have to, at some point, you're just gonna have to say yes to it because that's what it is. There is that very small percentage that it could be environmental toxin. And granted, it does happen, but it's easy to figure out the difference between the two. It's either you, and you find out by demographics, you just ask more questions. You find, and a skilled doctor will know based on symptoms. So he didn't need to go to a urologist, a neurologist, a cardiologist. He didn't need to go to a GI specialist. He didn't need to go to an ear, nose, and throat doctor. He didn't need to go to all of these different specialists that run him through this rigmarole to find out what's going on with him. He saw me, I nailed it. I got all of his symptoms knocked back within 5 weeks, and he will be symptom free in 15 weeks. He will be symptom free before he would be able to get his first appointment with a lot of these specialists. It's pretty sad. It's pretty fucking sad. But you know what? It's pretty cool that there are people out there that know the cause of disease and know how to get people out of it. Over and out. God bless.